My name is Mary Kurniawan, and I'm a social worker with Monument Health. A really big concern for a lot of us during this time is our kids, whether they're doing okay and how safe they are. We all have a desire to keep our kids safe and for them to not worry too much, but of course this is going to affect them just as well as it will affect us. So it's important to know that kids react in a lot of the same ways that adults do during these times. And there's some things that are a little bit more particular to kids or to teens. So some things that you might watch out for is excessive worry. Kids might start acting out a little bit more, especially teens. For younger kids, you might notice them reverting back to old behaviors like having bathroom accidents or bedwetting. You want to watch out for excessive irritability and crying as well. Sometimes you might notice a change in eating or sleeping habits. I think it's important to note that ability to focus and concentrate can be affected, and as parents are suddenly having to take on role of teachers, that's important to recognize as a pretty common reaction. So if they used to be able to focus and concentrate really well and that's less right now, that's normal. Some kids might also complain about headaches or other unexplained body pains that they haven't complained about before. And again, this is probably normal. The things that can really help kids cope with stress are often the same as the things that help adults cope with stress. You want to keep a schedule. Kids respond really well to schedules, so do teens, even though they don't like it as much. Schedules are important. Making sure that your kids and your teenagers are getting enough sleep is really important. It's important to reassure our kids that worrying is normal during this time, but also to focus on talking about things that we're doing to keep them safe, such as staying out of school to help prevent the spread of COVID-19. Kids are curious, and so they are going to ask questions about COVID-19, and it's important to answer those questions honestly, but to also really pay attention to how you're giving them that information, making sure that it is age-appropriate information. It's also important to not make promises that we aren't sure that we can keep, and it creates more concern and worry in kids when promises are made but then we're not able to keep them. It's a good idea to limit kids' exposure to media as well. Oftentimes kids don't completely understand what's being said or what's written, and it seems very scary to them because they might be misinterpreting these things. Another thing to watch for is using kind of exaggerated phrases or wording when you're talking about COVID-19. For example, saying things like, "This is the worst pandemic ever," or "This is really awful right now." These words create more anxiety and worry for kids. And finally, give your kids hugs. I've been telling my kids that hugs don't count unless it's 20 seconds or more, just like hand washing. And that's been really helpful for both myself and my kids. Schedule something fun, be silly, watch movies together, be kind and gentle to yourself, and be kind and gentle to your kids. Remember that kids are resilient, and so are adults, and it's our job to model that resiliency. We have some resources to share about how you can be resilient and cope on your own, and also how you can help your kids cope.